Good morning. We're here for the Health and Human Services Committee meeting this morning. First is, Madam Clerk, could you please call the roll?
Alderwoman Ingrassia.
Present.
Alderwoman Spencer.
Present.
Alderwoman Tyus. Alderwoman Green.
She's excused.
Alderwoman Martin. Alderwoman Navarro.
Present.
Alderwoman Middlebrook. Alderwoman Rice.
Present.
Alderman Todd.
Present.
Chairman Arnowitz.
Present.
7 present. You have quorum.
Okay, Alderwoman Green is excused from the meeting at this time, and Alderwoman Tyus is in another meeting, so she'll be over here. And I guess at this time, I'll entertain approval for the minutes from February 19th.
So moved. Second.
And so moved, seconded. Madam Clerk, could you please call the roll?
Alderwoman Ingrassia.
Aye.
Alderwoman Spencer.
Aye.
Alderwoman Tyus. Alderwoman Green. Alderwoman Martin.
Present, or yes, sorry.
Alderwoman Navarro.
Aye.
Alderwoman Middlebrook. Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairman Arnowitz.
Aye.
7 aye votes.
Thank you for approving the minutes from the previous meeting. First off this morning, we're going to hear resolution number 232, introduced by Alderwoman Christine Ingrassia.
Thank you, Mr. Chairman, members of the committee. I'm here before you on Resolution 232 today. This resolution will be honoring the memories of Dr. David Gunn and Dr. George Tiller, who were abortion providers and were killed because of the work that they do. And in light of the fact that we have seen a real attack here in the state of Missouri on reproductive health rights, we want to make sure that the doctors who are providing high quality and compassionate care to our patients here in St. Louis that are coming from all over the state of Missouri to receive care understand that the aldermen who are supporting this resolution are appreciative of their work and value their work and understand that it is a very dangerous occupation, and we are so grateful that they are undertaking this on a daily basis. I have Mallory Shores, who's the Executive Director of Naval, Missouri here, and I'd like her to say a few words, if that's okay, Mr. Chairman.
Yes, that's fine.
Okay.
Do we have a sign-in sheet? Just set it.
Honored Chair and members of the committee, my name is Mallory Schwartz, and I'm the Executive Director of Naval Pro-Choice Missouri. Thank you for the opportunity to speak today on behalf of this resolution offered by Alders Ingrassia, Tyus, Green, Rice, and Guenther. Naval Pro-Choice Missouri works to protect every Missourian's right to the full range of reproductive health options, including the ability to choose legal abortion. We often say at NARAL that we are not healthcare providers or litigators. We are activists and advocates, and this advocacy includes elevating and celebrating the honorable and courageous work that providers grant their patients every day. Abortion providers and all clinic staff are essential to ensuring that all who become pregnant are able to make their own decisions about their bodies and their families and their futures. We are grateful to these skilled health professionals for providing essential quality health care and indebted to them for stepping up to meet the challenge of increasingly serving both their own community members and those who travel from across the state for care. Recent anti-choice restrictions on abortion within Missouri have driven thousands of Missourians to Illinois, sometimes traveling hundreds of miles to seek care from the compassionate providers at Hope Clinic in Granite City, Illinois, and Planned Parenthood in Fairview Heights, Illinois, as well as here in St. Louis at Reproductive Health Services of Planned Parenthood. Healthcare providers at these clinics, many of whom even in Illinois are based in St. Louis, support their patients' decisions and treat them with dignity, compassion, and respect in a way that Missouri law often prevents them from doing. These providers and the clinic staff who support them and their patients are a critical and valued part of the St. Louis healthcare system. They put their lives on the line and suffer harassment on a daily basis in order to show up for the people who rely on them. Today, we have an opportunity to give something back. We have a unique chance to advance reproductive freedom and mitigate the negative atmosphere that's been created surrounding abortion rights in our current political climate. By honoring our own Dr. Tiller and the memory of Dr. Gunn, NARAL supports the recognition of Abortion Providers Appreciation Day and urges you to move this resolution forward. Thank you for this opportunity.
Thank you. Did you want to close or anything?
Yeah, I just asked for your favorable consideration of Resolution 232.
I will. We'll go down the line real quick, just in case you're up there. Alderwoman Spencer? She just left. Alderwoman Martin?
No questions.
Alderwoman Navarro?
No questions.
Alderwoman Middlebrook? Alderwoman Rice?
No questions.
Alderman Todd?
No questions.
And I have no questions. It's a very good resolution. If anyone would like to get on as a co-sponsor, you just let the clerk know. After that, I will entertain a motion to pass courtesy resolution number 232 out of committee.
So moved. Second.
I'm not going to ask for previous roll. Let's just do the roll call because there are a couple people not here.
Alderwoman Ingrassia,
Aye.
Alderwoman Spencer, Alderwoman Tyus, Alderwoman Green, Alderwoman Martin,
Aye.
Alderwoman Navarro,
Aye.
Alderwoman Middlebrook, Alderwoman Rice,
Aye.
Alderman Todd,
Aye.
Chairman Arnowitz.
Aye.
6 aye votes.
By your votes, we have passed the courtesy resolution, was it 292 or 220?
32.
232 out of committee with due pass recommendation.
Thank you.
Thank you. Next, we will hear Board Bill 191, introduced by Alderwoman Annie Rice. And I believe she has a committee substitute with her.
I do, and it should be in front of you already. And the talking points did not, the bill summary sort of talking points did not make it to you, but that's probably my bad. We'll talk about it if you have questions. Thank you so much, members of the committee. I'm bringing Board Bill 191 to address a number of places in our food permitting process that can greatly help to clean up and organize. So there's a couple of things. If you look at the original Board Bill 191, there's a summary on top that kind of walks through each of the pieces that we're addressing here. And the committee substitute has really minor changes. We had discussed some language changes with some of the co-sponsors, and they're very minor there. So I guess I would ask that we put Board Bill 191 committee substitute in front of the committee.
I move that we put committee sub, 191 committee sub in front of the committee.
All those in favor, we can't do previous.
You can do
Previous row. Seeing no objections.
Great. Okay, so I could talk about this, or I think we have a number of people from the health department here and some other organizations that would like to testify on the bill. So would you like to do questions of me first or have them testify on the bill? What do you think?
We can do questions from people that want to speak on the bill. So if you want to come up and sign and talk
Sure.
on the bill, I would just ask that you just hold your comments to about 3 minutes. Because they usually lead to 5.
Morning, Mr. Chair, members of the committee, thank you so much. This is, on a lot of levels, a bill about equity, so it's largely created in order to deal with some of the issues that we have now to allow some entrepreneurship within our communities so that people who live in low-income, low-access communities, which are defined as areas where there's a poverty level. 50% of the people are at poverty and live more than half a mile from a grocery store. There are also provisions with regard to charitable feeding so that the cost of a permit for that would be cut in half. There's also training provisions for that and for some of the other temporary permits. Let me back up. So currently, if you do a temporary permit in the city of St. Louis, it's limited to up to 14 days, and the permit is something like $50 a day, which is pretty high, but those are based to try to cover the health department's cost. What was recognized is that there are some sorts of activities where people have permits, such as a sponsored event or a marketplace, where the cost to the city is not quite as great as it might be going out to like 10 or 15 different locations. So we're trying to reflect that and then put those monies that would be saved into a fund to try to do some education. The health department's goal on all of this is to encourage positive provision of food, obviously within the city of St. Louis, but also to be protective of health. And so it's about compliance, it's not to be punitive. And so we're moving more and more into that direction. This really came about as a result of community, some folks who were trying to see ways that we could modify the regime in terms of how the costs are set forth, but also some people who asked things about low income, low access. And so part of it came out of the Missouri Coalition for the Environment. They are here today along with some other people to testify about this. But we really appreciate the opportunity. We're excited. I know our director's excited because it looks at some of those major racial equity pieces within our city, looks at the ability to provide more nutritional food for people at a lower cost in terms of those permits that could be viewed as a barrier.
Okay, thank you, Mr. Schmidt. I think we'll just hold off on questions. Everybody speaks, if that's all right.
Good morning.
Good morning.
Members of the committee. So I'm Janine Arraghi. I'm the Bureau Chief for Environmental Health Services at the Department of Health, and Food and Beverage Control is one of the programs in our section. And I just wanted to share a little bit about the process we went through to help develop some of the thinking behind this revision to the food code. You know, as Craig mentioned, the one-size-fits-all $50 permit 14 times a year did not really fit the needs of our community. And so we heard this from a number of different people, both from small business owners who had specialty kinds of food businesses. We heard about it from farmers markets. We heard about it from elected officials. And so we met with a number of people over the past year and a half to develop some of the concepts that we worked with Alderwoman Rice to develop in this board bill. We had at least 4 community meetings where people gave us input on what they thought would be beneficial in terms of the health equity issues. We have grant funding from the Food and Drug Administration to help fund some interns who are helping us with the development of this project, along with pursuing some other funding opportunities that might improve economic outcome for seniors. So I just would encourage you to positively consider the board bill. Thank you.
You're welcome. Has anyone else signed up to speak?
Good morning. My name is Jenny Ryan, and I am a co-founder of the Tower Grove Farmers Market. And I'm here on behalf of the Farmers Market and all of our food vendors and food entrepreneurs to express support for this bill. This bill will really help our food vendors have a much easier time of bringing their product to market. It's really important for people who are trying to reduce that barrier to entry for low-income folks to try and do this sort of work. It's really a great thing for the local economy, and we're just really supportive and appreciate Alderwoman Rice and Alderwoman Spencer for helping us with this process. So we urge you to support this bill. Thank you.
Tasha?
First, I want to say it has been a pleasure working alongside the Health Department under the leadership of Jeannie Lake. I want to say that there's a major shift happening in our current food system across the nation. We're seeing solutions coming from a combination of governmental agencies, organizations with communities taking the lead. And so with this bill, we're seeing St. Louis doing something that hasn't been done in the food system, and that's partnering with the health department. Across the nation, I've seen food system organizations work and do things to try to change the food system for communities most impacted by lack of food access, and I've never seen anyone work with the health department. So I'm proud that we've created something and we've done something that we can say that we've taken the lead in, and that we've done something in the food system that no one else has done, and that's work with our health department and say that the health department is on board with changing the current food system. Thank you.
Excuse me, who did you say you were with?
Missouri Coalition for the Environment.
Okay, thank you very much.
Reverend Charles Norris.
Well, good afternoon. I am Reverend Charles Norris of St. James AME Church, located in the Ville community. Been there since 1884. Also instrumental in starting the Ville Community Development Foundation. We come to voice our support for Bill 191 from a education perspective. We were instrumental in helping the Sumner High School start a science enrichment program. Part of that program, we were teaching young people about gardening. We have master gardeners that are part of our congregation, and we want to address some of the needs of the food desert that we exist in. Far too often in communities like ours, the only source for produce, fresh produce, are liquor stores. And so we would like to have people with higher quality fruits and vegetables available to them, and then also to start a farmer's market in the neighborhood so that people might be able to grow food and sustain themselves. Currently, we have a garden on our premises, as well as a garden that's underutilized at Sumner High School, and in starting a farmer's market, we might be able to bring together all of these gardens that are around the city, leverage those in such a way where we might be able to build a sense of community around food, but then also to teach people about nutrition. As we help people, young people academically, they can't learn if they don't have the right nutrition in their bodies. And so this is also another opportunity through some other programming we'll have this summer where we'll teach them about nutrition as well as teaching them about building computers, as well as chemistry and other programs that we currently have slated with Washington University. But it is important that they have the right nutrition. So we stand in total support of Bill 191. Thank you.
Thank you, Reverend.
Melissa Vetterat.
Good afternoon, Chairman, members of the committee. Thanks for the opportunity to weigh in. I can't keep this down. That's okay. There we go. Okay, cool. Thank you so much. I'm Melissa Vatterat with Missouri Coalition for the Environment. I'm the Food and Farm Director there, and in my role, I lead the St. Louis Food Policy Coalition, which is a coalition of organizations around the St. Louis area who are working to improve our food system. It has been a critical component of our work for the last 4 years to find innovative alternative solutions to improving access to healthy, equitable, sustainably grown food, and we see the opportunity here with Board Bill 191 to advance that very thing, make it possible in lieu of grocery stores or corner stores to be able, healthy corner stores rather, to be able to provide a community with opportunities for healthy food purchasing, and we anticipate that this bill will foster food entrepreneurship in census tracts where there is high need, as you
likely see, I don't know if the summary is in front of you, but one of the proposed changes in the bill is to have a permit that is more affordable in the low-income, low-access census tracts in order to recognize the need for equitable costs for these bills, so that we can encourage residents in low-income, low-access census tracts to be able to start food enterprises and be part of the solution to their food access needs. I want to thank Alderwoman Rice and the Health Department for working on this extensively over the last year and a half, and I'm very supportive of this bill, and I hope that you will consider it. It's also worth mentioning that I'm also in favor of the permit structure being proposed for farmers markets. I think, as Jenny previously mentioned, it will also advance equity, helping small-scale farmers, whether urban or rural, to be able to get into the farmers market venue for their products. Thank you so much for your time.
Thank you. Alderwoman Rice, would you like to come up and say anything, or?
Absolutely.
And then
So
we'll ask
I'm welcome to question, or open to questions as well. I think you've heard a good summary of the different areas that this bill addresses. It is, in the health department's interest to balance food safety with access, right? And I think this is really sort of a novel project for our city to go through with this. And I just want to, again, thank Alderwoman Spencer for lots of dedicated time on this as well. So
Okay, and I'll go
Sure.
down the row. Alderwoman Ingrassia?
I don't have any questions. I'm a proud co-sponsor, and thanks to all the stakeholder groups in the health department for your work.
Thank you, Alderwoman. Alderwoman Martin?
No, I just want to reiterate that I know everyone's worked really hard on this, so I appreciate it. And then I thought I was a co-sponsor, but I would like to be. Thank you.
Thank you, Alderwoman. Alderwoman Navarro?
Thank you. I also do not have any questions, but just, again, want to commend everyone who's worked on this bill, because I do know that our food system is complicated, and I think being able to make those connections between government, between the local community, between the people actually eating the food, we are learning how complicated that process is and how government can sometimes get in the way and make that more difficult and present unnecessary barriers. So I'm just really grateful to all of the stakeholders who have helped break down those barriers so that we can get more healthy food into the hands of people who need it, which is really all of us. So, but especially in those communities with low access. So I appreciate everyone for bringing this to our attention, and I look forward to taking the next steps, because I know this is not, this is not everything that needs to be done. There's still a lot more work. So look forward to working with everyone and moving into the future. So thank you.
Thank you, Alderwoman. Alderman Todd?
I don't have any question, but I would like to commend you for working on this food bill, because we have many food deserts in the city, and I would like to become a co-sponsor.
Thank you.
Thank you.
Thank you, Alderman.
Chairman, can I point out a couple of things on the primary bill are where the two attachments are, so the previous ordinance and then the map. And the map is, just so we're clear on the map, the reason why there's two sides of it is one is broken down by ward and one is broken down by neighborhood. So you can see where those low-income, low-access census tracts actually are, and where that permit will be utilized. So just because it's confusing at first glance that it's the same information just presented under neighborhood versus ward. So.
I got you. Good point. I actually have no questions, but I would like to be added as a co-sponsor. So if we don't have any more questions, I will entertain a motion to pass Board Bill 191 committee substitute.
So moved. Second.
Been moved and seconded. Previous row. Hearing no objection, committee, our Board Bill 191 committee substitute has passed out of committee. Okay, so we have, I think we're going to take a 20-minute break here. No, I'm just kidding. We only have one bill. Next we have is Board Bill 208, introduced by Alderman Narayan, and it's a Board Bill, it's a committee substitute. Thank you, Alderman.
Thank you. So I guess procedurally, do we need a motion to get the committee sub in front?
Yeah.
I move we put,
Sorry, first you have to introduce.
Oh,
Yes.
excuse me. Thank you, Chairman and members of the committee. You have Board Bill 208 in front of you right now, and there is a committee sub also in front of you, and I think it would be prudent to move over to the committee sub rather than the bill itself.
can I make a motion to put Board Bill 208 committee substitute in front of us?
Second.
Previous row? Hearing no objections? Go ahead, Alderman.
Thank you. Board Bill 208 is an asbestos remediation bill. First, I'd like to talk about a few of the changes that it's going to make to the existing ordinance, and then get into a little bit of the why. Alderman Spencer, 2 years ago, was able to pass a pretty large piece of legislation regarding air quality in the St. Louis City area. It was a great piece of legislation. This is just kind of tinkering with it on the margins in order to actually improve the air quality. So this isn't taking anything away from Alderwoman Spencer's bill. I think it's adding to it. So what these changes are, they apply to residential structures with 4 dwelling units, residential structures with 4 dwelling units or less are excluded from this. So this won't affect the individual homeowner who's trying to do something with their home. So in order to be considered an asbestos abatement contractor under the committee sub, a contractor must participate in the U.S. Department of Labor approved apprenticeship program that graduates apprentices yearly, teaches practices and safety techniques used in asbestos abatement, and they also need to be current in OSHA 10, AHERA, and ASHERA, which is the Asbestos Hazard Emergency Response Act, the Asbestos School Hazard Emergency Reauthorization Act, and the Occupational Safety and Health Administration. This bill establishes criteria to be considered either an air sampling professional or an air sampling technician through education and experience. It requires that air sampling professionals who conduct assessments to determine the presence and amount of asbestos in a structure be totally independent and in no way connected to the abatement contractor who will actually perform the abatement, which is a very important check here in the city. We found that when we allow the same contractor to do both the assessment and the abatement without independent oversight from anyone, we've seen 2 different types of corruption occur in the city. First, the air sampling professional could report lower levels of asbestos than are actually present in the building, and that drives down the overall abatement costs, but it leaves asbestos-containing material in the structure, or worse, when they do a demolition, it can put asbestos into the air. And B, the air sampling professional actually overinflates the amount of asbestos present to ensure that the contractors bidding on the project are basing their bids on more asbestos than is actually present in the building. So if that air sampling professional also conducts the abatement, the contractor turns around and can offer a lower bid because they know how much asbestos is actually present, and it essentially results in contract price fixing, and it results in additional costs and reduced safety to the taxpayer. The legislation will also set minimum standards for samples needed in relation to square footage to ensure adequate sampling, and it sets requirements for specific areas that need to be sampled, including outside of the containment area entrance, and it ensures that asbestos dust doesn't escape the containment area. I know that I've spoken with everyone on this committee right now, and that you're all aware of the dangers of asbestos. It ultimately only takes one exposure to asbestos to potentially develop mesothelioma far down the road. And so what this tries to, this bill ultimately tries to protect the citizens of St. Louis, particularly in areas where we have a lot of demolition work happening, because, you know, when that wrecking ball comes through and that asbestos is in the air, you know, the little girl walking to school 2 blocks away now all of a sudden has her first exposure to asbestos, and 30 years down the road, she develops mesothelioma, has no idea why, doesn't know when she had that contact. She wasn't working with asbestos. She wasn't, she had nothing to do with it, and now all of a sudden she's exposed to a very nasty form of cancer that we know only occurs from exposure to asbestos. So this is a problem of our creating, and we can also solve it. We have a lot of demolitions happening in parts of the city, and oftentimes those coincide with areas of the city where we have inequitable health outcomes to begin with. So this bill would offer an additional form of protection for those folks that live near buildings that are being demolished. As I mentioned earlier, the why on why we need to pass this, I have with me Theresa Paige, and I'd like to have her give some testimony on the issue here to put a human face to it. The folks that I've been working with on this, as soon as it kind of came onto my radar, I realized what an important issue it is, and they've pushed for this to affectionately be named Theresa's Law as a result of the situation that she finds herself in through no fault of her own. So I would, with the committee's permission, I would like to have her say a few words.
And that's fine. And I think you have some other speakers that want to speak briefly to the bill. We'll put a sign-up sheet out there and come up, sign it, and speak.
Absolutely.
All right.
And,
Thank you. Go ahead. Thank you, Alderman. And when you come up, just introduce yourself, please. We know who you are.
My name is Theresa Paige. Thanks for having me today. I appreciate the opportunity to speak to you all. I'm sorry. Sorry. So nervous. I really appreciate that you let me come in. It means a lot to me that we've gathered to not only talk about asbestos in the workplace, but to potentially do something about it. Something that could potentially save lives like mine, as well as the lives of the men and women who built this building that we're all standing in today. Men and women who work hard every day and should never have to worry that their lives are at risk at their jobs. For those of you who don't know me, I'm Theresa Paige. A few years ago, I was diagnosed with asbestos-related mesothelioma, which, as you can imagine, makes this all feel very personal, even when I know it's all just business. I worked in St. Louis. I was on a demolition team, and I worked for someone who did not give us the proper abatement suits and just cut corners. So their oversight has sort of cost me my life. So I am very excited that we do have this opportunity to maybe make some kind of change. I just had my 4th surgery and my 2nd round of chemo right after Christmas. Recently, I asked my doctor, how many surgeries can one man have? Which he deflected with a very calm, as many as his body can withstand. Rephrasing my question, I asked him, what's the highest number of surgeries he's ever performed on one person? His answer was the number 10. So I'm halfway to breaking his personal best. But 10 was the number. Numbers are interesting in the sense that they hold so much information in them and so much power. Numbers like 6 months to 2 years, that's the prognosis for my disease, for my cancer. 39,000 is the number of lives lost in America every year due to asbestos-related illnesses. 60 is the number of countries that have banned asbestos entirely, although America is not one of them. 5 is the number of months I missed of work last year. 3,000 is the number of Americans that are diagnosed every year with asbestos-related illnesses, just here in America alone. And 2 is the number of children that I will leave behind. 13 and 14 are their ages. Numbers. Someday I'll be added to that list of numbers, and I won't be able to stand here and ask you in person to protect the people who elected you, to act on their behalf, and to keep them safe in the workplace, to keep them healthy and able to take care of their families. Today, I see at least 6 people who have the power to impact hundreds of lives. Numbers can be powerful. Today, we can change the numbers. Tomorrow's not promised for all of us, so if time is of the essence, then I hope that you will help me today to change the numbers for tomorrow. Thank you for having me. I really do appreciate it.
Thank you, ma'am. I really understand what you're going through, being a farmer, labor, and worked around asbestos in a few places. And always I remembered our safety was, you know, once you did it for so many minutes, you had to come down, you showered and did this, and we had the right safety equipment. So, yes, you're still going to have some contractors out there that's always trying to cut corners. So that's why we all here very much support unions and what they do for the safety of their workers. But I'm going to ask if anybody on committee wants to say anything at this time. Go ahead.
Wow, that was really powerful. Thank you for being brave enough to share your story. And I think all of us up here were already supportive of the bill, but now even more so.
Thank you. Is there anyone else that wants to speak on the bill?
I believe that Clint McBride would like to say a few words on it.
I don't have a whole lot to say that hasn't already been said. I'm sorry,
Sir,
Clinton
could you
McBride
please introduce yourself?
Clinton McBride. I'm a resident of the 15th Ward, actually. I just wanted to reiterate, some of the stuff that Bret said. We need to make sure that contractors aren't able to cut these corners at the cost of the people doing the work. We need to make sure that taxpayers are kept safe in a situation that, this stuff, once it gets airborne, it can go a very long way and it can affect a lot of people. Not only does it affect the workers that are working on it and the people living around, but also every single person that comes into that building afterwards, if it's not done properly, is put at risk. And you think about the person who, if they're not in the right clothing or they don't know that something is asbestos-containing material, and if you don't have the proper training, you don't automatically know, looking at something, to be suspicious. And whenever that happens and you don't have the proper equipment, think about the clothing that you're wearing, that you take home, that you put in the laundry, right? What if a child's playing in that, or whatever, right? I mean, it's really easy for this stuff to spread, and this is why this legislation is so important. So for that reason, I would like to say, the laborers union is in full support behind this legislation. So with that, if you have any questions, I'd be happy to answer them.
Yes, Alderwoman Martin.
I just want to say that I know I deal with this on a state level, but I constantly hear that, people just don't get mesothelioma anymore, asbestos isn't around anymore, and I just want to make that very clear, and we saw today that it's affecting lives, and then their family members' lives as well, the victims, and so I just want to make that very clear, that this is not something of the past. So thank you very much for your work on this.
Thank you. Thank you.
Okay, Ms. Alderwoman Ingrassia.
No questions.
Alderwoman Tyus.
This is just a question as the chairperson of rules. When did we get this committee substitute?
More than 24 hours in
Okay, just
advance
wanted
of
to
this
make sure. I've been doing a lot of other things.
Absolutely, no.
I'm actually one of the co-sponsors, but you know how I am about that.
Absolutely,
Okay,
no.
I have no questions. I
made sure of that.
That's what I wanted to make sure of.
And
Thank you, Alderwoman. Alderwoman Martin said, Alderwoman Navarro, did you have anything?
Yes, I do have a question. I'm wondering, I'd just like to understand and I'm very supportive of this bill, and again, I appreciate Ms. Paige's testimony here to really bring to light the issues. In terms of just the context of what the workforce looks like currently, so right now, are all abatement contractors also doing the sampling, or do we have a pool of people who are ready to go to do sampling separate from the abatement, so there's not any delay and that sort of work getting done? I'm just curious what the labor numbers look like there.
So I do appreciate the question. I've brought with me a subject matter expert. I certainly don't have the answer for you off the top of my head. I believe that John here may be able to answer your question, though.
We have a little entertainment here for a second and a break.
That's what we introduce the important people.
Thank you for listening to me briefly, hopefully. My name is John Bunner, and I'm a retired instructor for the Laborers Union. I taught asbestos abatement for over 23 years and worked in the field a lot longer before that, along with all the other health hazards that all the citizens in this city are being exposed to on a daily basis. To answer your question a little bit more in depth, right now currently under OSHA guidelines, if there's a small amount of asbestos being abated, the contractor can run his own samples until final air. What this bill is we want to take that out of the contractor's hands. Not that they're all bad people, but that we want to make sure that we have as much of the up and up as we can when we're doing abatement in this city. So there's a 160-260 rule that is federal. Excuse me, I think that's in these guidelines as well. But here what we want to do is make sure that we don't have a fox watching the hen house, if you will. So did I clarify it a little bit more?
Yeah, a little bit. I just want to make sure, do we have a sense of the number of air sampling technicians and supervisors we have available? Are we going to need to do any sort of additional training to make sure that we've got people available?
There's plenty of reputable
Okay.
laboratories in the city
Great.
of St. Louis that do this work on a daily basis. Some contractors, and I will state the good ones, don't even worry about doing their own samples anymore, just because it's a liability issue. But then you're going to get out-of-towners coming in, and they want to save every nickel they can, and that's one way of doing it, is trying to skirt air sampling, therefore skirting safety, therefore everybody in this room gets exposed unnecessarily. So.
Okay, thank you. Yes, that's very helpful.
Thank you, John. Is there anybody else signed up to speak?
I believe so.
Oh.
Janine Erigi from the Health Department is.
Good morning, or maybe it's afternoon now, to the members of the committee. So my introduction to public health was in 1986 when I went to work for an asbestos consulting firm. And so I've been involved in this kind of work for a number of years. A couple of years ago when Alderwoman Spencer came to us with concerns about the fact that we no longer had an air pollution control program in the health department because of the defunding from the Department of Natural Resources. We worked to introduce the board bill that year. I believe it was Board Bill 86 that became Ordinance 70607. And so when Alderman Narayan and I came to me, yeah, we can have the battle of our names. With this request and plan to make these revisions, I stand behind it. I actually am a lifetime Missouri Certified Air Sampling Professional. So there are, you can find them on the Department of Natural Resources website. There are hosts of people who have these credentials. And I think that this board bill has the opportunity to close some gaps about some areas that Alderman Narayan brought to your attention that I think are going to be ways that the health department's air pollution control staff, we have 2 air pollution inspectors now, who will be able to ensure that these kinds of practices are in place, and that we have the potential for citing people when they don't follow those requirements. So thank you.
Thank you, and also remember, if we can get rid of some of the chiefs and keep more of the Indians up there would help. If anyone else is not going to speak, Alderman, if you want to close on your bill.
Thank you, Chairman. I would, I think we've heard a lot of touching testimony here today about the reality of the situation that we find ourselves in the city. Like I said before, this is a problem of our own making here in the city, and this is a problem that we can solve. Ultimately, with these demolitions happening, there are good practices where we can reduce and hopefully eliminate the concept that people, both workers and residents of the city, have any exposure to asbestos. And we have the power to affect people's lives in pretty incredible ways here. So I would ask for this committee's favorable support in passing this out with a do-pass recommendation. Thank you.
Thank you. And Alderman, I'm going to go down the road just real quickly in case anyone has any questions. Alderwoman Ingrassia?
No questions.
Alderwoman Tyus?
No questions.
Alderwoman Martin?
No questions.
Alderwoman Rice?
Actually, so one question touching on our current city demolitions, right? So demolitions that are being directed by the city, we hire contractors to do that. What is just walk me through, so say somebody's taking down a house that is currently under contract. If this were to go into effect tomorrow, right, what would be the difference, what's the tangible difference in how this would get treated, or how that contractor would get treated versus what it currently is?
I appreciate the question. So I think it is important to note that in the instance of like a single-family home, which is, I think, where a lot of people say, oh, is this going to create an undue burden for residents of the city? This bill is only applicable to dwellings of 4 units or larger.
Okay.
5 units or larger, excuse me. So for the single-family homes, this wouldn't create a burden for the homeowner and the resident.
Okay. Is there a not punishment isn't the right word, but is there an enforcement piece for, even if it was a single-family home, since we're talking about air quality and all, if asbestos was found in the air around a demolition, does this bill offer any sort of enforcement mechanism for the health department to fine someone?
So our powers as a city to fine in general are quite limited. I believe per the charter, we can only fine $500, which is negligible when you're talking about a situation like this, when you're talking about people's lives. So the key of this is to create a system which is far less likely to be gamed in the first place, to prevent the asbestos from coming into the air rather than to try and clean up the mess afterwards. Because with the independent oversight, the hope is that you get good practices going into the demolition and you don't end up with that asbestos in the air or environment in the end either way. And I believe, yes, absolutely.
I'd like to add something to that because The Department of Health does have a memorandum of understanding with the Missouri Department of Natural Resources.
Okay.
So any of the demolition projects or abatement projects that would fall under their purview, we have the responsibility under that memorandum to refer cases where there's violations to them, and they have a little bit better enforcement ability than we do here.
So that would apply to single-family homes, or is that still
It would only apply to a single-family home if there were more than 160 square feet or 260 linear feet of asbestos-containing materials in it.
Okay, okay, all right, that's helpful, thank you.
Well, and actually, residential structures, 4 dwelling units or less are exempt from federal and state regulations, so that would not
Okay,
apply.
okay, so we're talking about larger commercial structures
Yes.
in this, okay. Thank you, that's helpful to clarify, because I know we get lots of questions as all of these homes and these buildings are being demoed, when there's dust kicked up and all of that, what that impact is, so. Good to know. I thank you very much for bringing this forward. Thank you all for all of your hard work making this happen. This is a long overdue step, and thank you so much for coming to testify. And I'm so glad to still see you here, and hope that we can keep you around for as long as possible. So thank you, and I'm a proud co-sponsor.
Thank you, Alderwoman. Alderwoman Navarro, I apologize, I skipped over you.
Quite all right, thank you. Alderman, if you could just, I'm looking at the marked up copy of the bill, and there's obviously a lot here that has been lying. There's more, it looks like there's more happening in this bill than what you've described so far today. So I'm wondering if you could just walk us through, and just like, for example, there's a chart, table B of limitations that's
And it's all
it's all scratched off, and I'm just wondering, is it moved somewhere else, or can somebody just tell us what all the rest
I'll
of this
defer
marking
to-
up is about? Thank you.
So unfortunately, when we introduced Board Bill 86 in 2017, and it became Ordinance 70607, it was adopted with all the strike-throughs and all of the underlines, and so the actual ordinance itself never was cleaned up. So what we're hoping to do in the next few days is develop a floor substitute that would get rid of all of those strikeouts and underlines, so that the board bill will probably be more like 30 pages instead of how lengthy it is. The reason all those changes were made in 2017 is because under our negotiations with the Missouri Department of Natural Resources about what services they continue to provide for air pollution control in the city, they are providing those things that we struck out of the previous ordinance that was in place.
I'm sorry, you said DNR is providing those things?
Yes, they are.
Okay. So for example, so then this chart on limitations regarding, particulate limits, that still appears somewhere, or you're saying that appears in DNR's
That's in
regulations?
DNR's regulations. It has to do with construction permits and operating permits for larger air pollution sources.
Okay, I just want to make sure that in doing this, we're not gutting the heart and soul of asbestos protection. Okay,
No,
all right, and I
no-
will leave that up to the Rules Committee to verify and look that over.
Just to add to Ms. Arrighi's statements, if you read the first paragraph of the committee sub, it does say that it's making technical changes for clarity and readability. I know when I talk to the health department, they mentioned that, especially in the field and when you're trying to research the statute itself, it's kind of unwieldy with all that struck-through language. So as she stated, we will be coming forward with a floor sub that will clean this up even further. Had there been more time in the session, it would have come today like that, but we had to move this because it's such an important issue. So we will be seeing a cleaned up version without all that struck through language.
Great, thank you. No further questions.
Thank you. Alderman Todd?
And I don't have any questions.
Thank you, and I believe Alderwoman Ingrassia has a follow-up question.
Thank you, Mr. Chairman. Alderman Narayan, could either you or Janine Arighi speak to, I believe it was October of 2019 when I had an issue in related to asbestos in Lafayette Square, and the level of asbestos did not rise to the state doing anything, and I was told at that time the city would be taking the program over again. So can you talk about whether or not that happened, and if this makes the limit more restrictive than it previously was?
I would defer to the health department on that.
Thank you.
So I am familiar with that situation, and as of November 1st of 2019, our memorandum of understanding, or our memorandum of agreement with Missouri Department of Natural Resources was in place, so that we have 2 air pollution inspectors now on staff. They are routinely going out and doing inspections on notified properties, and also just traveling through the community if they have concerns about any projects that might be going on. We've worked with the building division, which has a web portal called stlcitypermits.org. We're developing that so that asbestos abatement contractors, as well as the demolition contractors, can submit their notification information online and make it more expeditious. That particular situation was rather unusual, and it was difficult to ascertain after we received the complaint what exactly happened. I believe there was some construction work going on an upper level, and that caused some asbestos release from some ceiling materials down into the space. So really, it's one of those borderline situations where do we, what were they doing when they were doing the construction? Had they tested for asbestos? If they had not, because it was commercial property, basically, as an apartment complex is a commercial property, if they had not tested for asbestos and had not, before they began their work, then they could be cited for a violation of our ordinance, because prior to any renovation activity, over 10 square feet or 16 linear feet of asbestos material will be disturbed. They must notify and inform us. So the state's regulations are not as stringent as that. So their limit is 160 square feet and 260 linear feet, the federal requirements. So our ordinance is a little tighter than that. We would have been able to respond.
Okay, and so that changed as of November 1st?
Yes.
Okay, thank you so much.
Alderman, if you would like to close on Board Bill 208 Committee Substitute.
Thank you. I would ask for your favorable support in getting this out of committee with a due pass recommendation. Thank you.
At this time, I will move and entertain a motion to pass Board Bill 208 Committee Substitute out of committee.
So moved.
Second.
Madam Clerk, would you please call the roll?
Alderwoman Ingrassia.
Aye.
Alderwoman Spencer. Alderwoman Tyus.
Aye.
Alderwoman Green. Alderwoman Martin.
Aye.
Alderwoman Navarro.
Aye.
Alderwoman Middlebrook. Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairman Arnowitz.
Aye.
7 aye votes.
Thank you. By your vote, we have passed Board Bill 208 Committee Substitute at this time out of committee.
Thank you.
I don't believe we have anything else on the agenda. So at this time, I would entertain a motion to adjourn.
So moved.
I like to do. Okay, second. Thank you, Alderwoman. Here are no objections. Health and Human Services is completed.